Bismillahirrahmanirrahim. Assalamu alaikum. A 59-year-old woman come to the office for a routine visit. She report no symptom. She has no medical problem and takes no medication. She grew up in the United States and has not traveled outside the country. The patient does not use tobacco, alcohol, or illicit drug. Her blood pressure is 120 by 70, pulse is 88 per minute, and respiration at 14 per minute. Physical examination show a firm non-tender mass in the right upper quadrant. The remainder of the examination is within normal limits. Laboratory testing is unremarkable. Abdominal CT scan is shown in the image below. This patient is at greatest risk for which of the following condition? So this is the CT scan of this patient, which shows the gallbladder is a gallbladder having calcified rim, and there is a central bile filled dark area. So this patient is the greatest risk for which of the following condition? Here the correct option is choice B, gallbladder adenocarcinoma, because this patient is 59-year-old woman and she came to the office for a routine visit. On abdominal CT scan, which show that there is a calcified rim in the gallbladder, and the patient will have at a greatest risk for the gallbladder adenocarcinoma. This is the porcelain gallbladder. I will show the photo of the porcelain gallbladder. This is a photo of the porcelain gallbladder, which show the gallbladder wall calcification, and there is a calcified center rim, which show that there is a bile filled dark area in the center of the gallbladder. Porcelain gallbladder is usually diagnosed on abdominal imaging showing a calcified rim in the gallbladder wall with a central bile-filled dark area. It is associated with increased risk for gallbladder adenocarcinoma and usually require cholecystectomy. Come to the incorrect one. Anaphylactic shock. So patient having anaphylactic shock, there will be a rupture, a kind of coccal cyst, which can cause anaphylaxis with eventual shock. On CT scan, there will be a cystic liver lesion without gallbladder involvement. It will be unlikely in a patient who has never traveled outside the United States. Choice C and D. I will explain the choice C. Hepatic abscesses. So patient with liver abscesses is typically amoebic or bacterial in origin, not a complication of porcelain gallbladder. I will explain the choice D and E together. Intestinal perforation and liver cirrhosis. So porcelain gallbladder is typically not directly associated with intestinal perforation or cirrhosis of the liver. Choice F, renal cell carcinoma. So patient with renal cell carcinoma, the risk factor includes smoking, hypertension, and obesity, not porcelain gallbladder.